let me introduce the two of you to my Health Power audience, our Health Power audience. Dr. Dolan, you're a medical advisor to the March of Dimes and co-author of Healthy Mom, Healthy Baby, The Ultimate Pregnancy Guide.
That's right.
And also professor of clinical obstetrics and gynecology at Albert Einstein College of Medicine. Is that correct?
That's right. Yep, in New York City.
Yes, thank you. And Dr. Lynn at CDC, both a pharmacist and epidemiologist or person who studies disease patterns with a focus on safer medication used during pregnancy to prevent and control the risk of birth defects.
Absolutely, that's correct.
Okay, well, we're going to primarily talk today about the use of antidepressant medications during pregnancy and their relationship to the risk of birth defects. I'll ask several questions of Dr. Dolan and then have you, Dr. Lynn, talk about the teaming effort between CDC and the March of Dimes.
Okay.
Okay?
Yeah, sounds great.
Sounds good.
All right, now, Dr. Dolan, is taking antidepressant prescription medication during pregnancy dangerous? I guess we're talking about it, so it is. But is it dangerous, and why is it dangerous?
Well, I don't think there's a simple answer to that question. And I think what the study we're releasing today shows is that it's really common. So 1 in 7, or 15% of American women, filled a prescription for an antidepressant. And these are reproductive age women, ages 15 to 44. So what that means is thinking about pregnancy and thinking about mental health are really in the same equation for a lot of women. And in this study, at least 15% of women. And so we really need to start the conversation, and we need to have the conversation. And there's not simple answers here, but there's really the opportunity for women to speak to their healthcare provider and weigh the risks and benefits of medication with really the risks of untreated depression, because there are risks to that as well. And think about the best solution for optimizing a woman's mental health and having a healthy pregnancy outcome.
Why antidepressants as compared to other medications?
Actually, this messaging is for all medications. We're drawing attention today to antidepressants, but the same could be said for a variety of other medications. And the Treating for Two initiative is really looking at medication use in pregnancy.
So generally speaking, it's not a good idea for women to take more medication than they absolutely have to during pregnancy.
That's right, generally speaking, but there are certainly medications that are needed during pregnancy. And what we want to do is have data and evidence to support conversations where women and their providers can think about the best choice of medication to reduce symptoms, get to good mental health, and then have a healthy pregnancy outcome.
So now, are the antidepressants more dangerous than most other medications women might be taking during pregnancy?
You know, there's some conflicting evidence with some concern about some antidepressants in certain women, so it's not a blanket answer. Each woman is different and each situation is different, so we really are encouraging conversations where an individual woman talks to her provider. And you know, in some circumstances, a woman may have a few providers, right? She may have a mental health provider, a family doctor, an OBGYN, and so if she puts all the conversations on the table and has this conversation, she may be able to come up with some innovative strategies that team up her whole healthcare team to really, again, get her to a place where her mental health is well positioned and she's going to have a healthy pregnancy outcome.
Okay, and one other question before we switch over to Dr. Lynn. I guess two questions. One question, is depression unusually common or more common during pregnancy than many other illnesses?
So, you know, depression is common, period. And pregnant women are not immune to depression. There is, I think, some evidence that women who suffer from depression have a greater risk of postpartum depression. So that's a unique aspect of mental health around pregnancy. But the bottom line is it affects many women. Postpartum depression affects many women. And we really want to bring this condition, this health condition, out into the forefront, encourage discussions, and encourage that women talk about it and get treated and get healthy.
And then the link that we want to be sure we make for the audience is that with the use of antidepressants and some other medications, there's an increased risk of not having a healthy baby. Is that correct?
Well, this is National Birth Defects Prevention Month, and so as I said, we are looking at ways to reduce birth defects, and some of this effort around medication use in pregnancy is to really optimize pregnancy outcomes, and part of that is minimizing occurrence of birth defects. But the data is not strong that there's an absolute link, so we really want to encourage open conversation.
Okay. And Dr. Lynn, could you tell us something about the teaming effort between the March of Dimes and CDC?
Absolutely. So CDC and March of Dimes have had a long-standing partnership where we work to educate women about having a healthy and full-term baby. We're currently working together to provide better research and reliable guidance through our Treating for Two initiative, and really to help develop resources to aid those conversations between women and their healthcare providers so that they can make informed decisions about the best treatment option for them and that they can have a healthy, safe pregnancy.
Okay. And what are the specific goals or connections between those two, between the...
Okay, well, we have to wrap up now, but the main goal is to provide better research and reliable guidance so that women and healthcare providers can make informed decisions about the best treatment option of health conditions during pregnancy.
And where can our audience get more information?
Absolutely. You can go to cdc.gov/treatingfor2 or marchofdimes.org.
cdc.gov, and where's the other one?
/treatingfor2 or marchofdimes.org, and we have a wealth of resources for women.
Okay, I want to thank both of you for chatting with me today, and I'm sure this is helpful information for our audience.
Thank you.